How are you, Bernadette?
Hi, I'm good. How are you?
Good.
Good.
Hey, Kelly. Hey, Michelle.
Hi, Melissa. Excellent. So we're
Yeah,
just waiting for.
I
Arash.
don't know how all the other sessions
I
went.
think you're on mute. Yeah.
No, I'm not. Can you not hear me?
I can hear
You're on
you.
mute.
Okay. I'm not on mute.
Oh,
Yeah, I can hear you, Melissa.
Okay.
can you hear? Maybe it's
I can hear you,
my
Michelle.
audio. Kelly, can you hear Melissa?
Yep, I can hear Melissa.
Yeah.
Everybody
Yep.
can hear me but you.
Okay, hold on.
Oh, she can't hear me though.
Bernadette, can you hear?
Yeah, I can hear everyone.
Okay.
And then the only other person that needs to join before 6 is Dr. Asher, correct? There's no
Right.
one else that would be. Okay. So then once 6 o'clock hits, I'll admit everyone that's still in the waiting room.
Okay.
How many are in the waiting room? Can you tell?
Right now there's 4 people.
Okay, that's at least a
Waiting to
good sign.
Yeah, they're
Now I
eager.
can't- I
They're
still
here
can't hear
early.
you. That's weird. Oh,
Poor Michelle in the
I'm
our
going to
meeting.
text Michelle and tell her just to log out and go back
Yeah.
in.
In the middle of one of our meetings, Michelle's power at her house went out.
Oh my gosh.
But they have a generator, and so she was able to get back off pretty quickly.
Just text
Her
her, but now
husband's
she's not by her phone now. So let's see.
Kelly,
So Bernadette,
Kelly and
are you-
Bernadette, thank you both for all of your help. I don't know who all did what with pivoting to all
I'm
virtual,
telling
but
you, these
that's
things are
hard.
always,
on seamless.
I was on Teams all day. Hold on. Let me just.
And sometimes it's Zoom too that can cause problems.
I was on Teams
feel
all
like
day.
I-
Now I have
Teams-
this is on Zoom, and I can't hear anything.
Oh, good. She muted.
Yeah, I think it might be best if she tries just logging out and then
I
coming
sent her a
back in.
text that said,
Okay,
try to
okay.
log
I
out
figured you
and log back in. So
Yeah.
hopefully
Okay.
she'll try and do that. And she'll just drop out for a minute and try and come back. So Bernadette, is there any way to send people who are in the waiting room a message or
Yeah.
no?
Yep. I can do that.
Okay. If will it go to everybody, or do you have to do them to each individual?
It'll go to everyone that's in the waiting room right now.
Okay.
Yeah.
I would just say, thank you. We will open up the meeting room in about 5 minutes. Thanks for logging in. We're glad you've
I just said, hi,
logged in
everyone.
to hear the lecture. I'll open up the meeting from the waiting room or whatever,
Yeah.
just so they know it's not like you're sitting there and watching it
Right.
spin.
Right.
Okay, perfect. Melissa, how was the emerging from the haze?
It was good. It was really good.
Good.
So I just talked to Arash, and the link he has is not working. So I resent him the invite I just used to get on. Okay, and then he's trying
Okay.
that.
I
don't
sent him
know.
the meeting invite that
He
we
said
all are
He said
on
something
right
about a
now.
firewall it said something about a
Oh.
firewall or some. So
Wow, we've got 5 minutes.
We'll figure it out.
But everybody had a good meeting with him today, as far as you know.
Oh, well, as far as I know, yeah.
Good.
Hey, I have a quick question for you, Kelly.
Sure.
Our patients, is there like a chat box that they can type in questions?
Yes.
Okay. And can everybody see that? Like, will I be able to see that and everything?
Yeah, you will. Bernadette might be able to give you better cues for how that works.
Okay.
Yeah. No, you'll definitely be able to see it. So at the bottom of your screen right now, like if you just move your mouse, you'll see at the bottom of your screen, it'll
Yeah.
say chat. So just click on that and then it'll come up on the right-hand side
Yeah, I'll just
and
leave
you'll
it
just
up so
see,
that I.
yeah, Yeah, I would do that.
And then when he's done, I'll just take questions and
Okay.
take it from the chat box.
Yeah, that's
Perfect.
perfect.
Just wait 1 second, and Kelly
Yeah,
or Bernadette, can you
Yeah.
resend Arash the invite again? Because the one he has is Colleen. He has the one from Colleen,
I sent it to him yesterday.
and
But
the
I
one
cer-
on his
I certainly
invite
will.
is that your?
It's tinyurl.com/UCC survivorship.
Yes, that's what it should be. And what are
He-
you getting when you try to go in?
I tried it on 3 different browsers.
Okay.
And it says can't reach this page. Another browser says the connection was reset. The site can't be reached.
Michelle,
Says try
I'm-
checking the connection, checking the proxy and the firewall, and I click on that.
Michelle, I'm gonna send you a new link
You're
so that he
using a
doesn't use the tiny URL link.
server.
Okay,
I think that's
hold
the
on 1 second,
problem.
Bernadette.
Administrator.
Hold on 1 second, Bernadette. Are you sending it to him or to me?
She's gonna,
Send
she
it to
can send
him.
it to him.
Yeah, send it to him directly.
Okay, I don't know if I have. Let me pull up his email. Sorry, I don't have.
It's arash.asher@cshs.org.
Bernadette is sending you a new link.
Okay.
Yeah, this one should work. Sometimes with tiny URL, we've
She said
run
this
into
one should work,
issues.
so don't
Yeah.
worry.
Okay.
And I'll stay on the phone and you can just tell me as soon as you get it, and then
If not, my cat just entertain people here.
Okay. Okay, just sent that.
okay, she just sent it to you.
That link should work with no problem.
Okay.
Thanks,
just got
Bernadette.
it.
Okay,
Let me click on this.
let's see.
Oh, this one's working.
Oh, it's working. Okay, he should
Great.
be here soon.
Okay.
Thank you, Bernadette.
Yeah, you're welcome.
All right, I'm gonna mute out so we can just
Okay.
have Melissa
Bye.
and Dr. Asher.
Okay, I have him.
right.
Okay,
Good
there he
luck.
is.
And then
Melissa,
do you all
once-
want to let Bernadette know when
Yeah, I was
to
just gonna
open
ask.
up the lecture?
Go for it. You can open it now that
Okay.
he's here.
All right.
Okay, I'm opening it now. Thanks, everyone.
Thank you.
Should I share my screen yet, or do you want me to wait?
You can wait because I'll do an introduction and then you can share it.
Okay.
Welcome, everybody. We're just going to give a few minutes for people to get logged in, and then we'll get started in just about 2 minutes or so. All right, I'm going to go ahead and get things started in the interest of time. My name is Dr. Melissa Erickson, and I am the Medical Director for Cancer Survivorship. And we are so delighted that you guys are here joining us tonight. It's really my privilege to introduce Dr. Arash Asher to tonight's event. Dr. Asher has served as the Director of Cancer Survivorship and Rehabilitation at the Samuel Oschin Comprehensive Center Cancer Institute at Cedars-Sinai Medical Center in Los Angeles since 2008. Dr. Asher earned his medical degree from the University of Rochester, then completed his residency in physical medicine and rehabilitation at UCLA, where he served as chief resident, followed by a fellowship in cancer rehabilitation at MD Anderson Cancer Center. He is board certified in physical medicine and rehabilitation, as well as hospice and palliative medicine. Dr. Asher has a special interest in the physical and rehabilitative needs of cancer survivors who continue to experience the effects of cancer or its treatment. He has led the development of a number of unique cancer survivorship programs with his colleagues, including Emerging from the Haze, which is living with the perceived effects of cancer treatment on cognition, Grace, which is growing resilience and courage, and many others, with a goal of optimizing physical, psychological, and spiritual resilience for patients with cancer. His research interests reflect his passion for improving outcomes for cancer patients and his expertise in the non-pharmacologic management of pain, cancer-related fatigue, cognitive dysfunction, neuropathy, exercise prescriptions for cancer patients, and the management of other musculoskeletal problems. Dr. Asher currently has several active studies, including one evaluating the role of Qi Gong for chemotherapy-induced peripheral neuropathy, and another that studies the impact of improvisational comedy on the well-being of breast cancer survivors. We are beyond excited to have Dr. Asher here tonight to talk about such a very important topic. Welcome, Dr. Asher.
Thank you so much, Dr. Erickson, and I really appreciate the opportunity to virtually, at least, be with you all. And I hope we get to the point where we could do these kinds of events in person soon. But I'm going to get ready to share a topic that's very near and dear to my heart. But I'm first going to ask the host to allow me to share my screen, whoever that may be. Dr. Erickson, I don't know if that's you or somebody from your team.
I'm going to take care of that in just a second.
Thank you so much.
Yeah, you're welcome.
So bear with us momentarily as we just take another moment to get set up. And as I'm bringing up my slides, I'd like to invite you to feel free to ask me questions. Feel free to use the chat as we go along the way. I'd like to make this in a way that makes sense, interactive as best as possible. And the topic is that of resiliency. And the reason why this is very near and dear to my heart is that ultimately, after going through the intensity of the diagnosis and the treatment and all the physical side effects, I think in many ways, this is really the heart of the matter in terms of what's going to really allow us to have a fulfilling and meaningful life after going through, for what may be for many of us, a very difficult time. So perspectives and strategies for managing that kind of distress. And I'd like to start by talking about something that's often talked about in the medical literature for those that study this idea of suffering or anguish. And there's generally these four domains that are talked about. We either tend to be, and all of us experience this sometimes, right? When we're going through something that causes significant distress or suffering, we either become preoccupied with something in the future or the past. We feel disconnected to the world, others, ourselves. Another common thing we hear is that we feel like we don't have a sense of control of what's happening around us, or what's referred to as an existential vacuum. We just can't find a sense of meaning in our circumstances. And I realize I'm talking about this in the context of going through cancer diagnosis, but if I just pause for a second, I think it's fair to say that given what we've all gone through around the country with the pandemic, I mean, at least the medical literature tells us that there's stress and increased rates of suicide and anxiety and post-traumatic symptoms and loss and sleep issues and substance abuse. There was a recent study just from a few weeks ago, just looking at the staggering numbers of overdose and burnout. So no matter whether we're talking about a medical diagnosis or other circumstances, this is a common concern. And I'd like to try in the next few minutes, provide some strategies that I think can be helpful to at least think about. And again, if we just pause and think about the big picture of if we went through, let's say, surgery or chemo and radiation or a combination of all of these treatments, ultimately, I think these three questions that I'm going to pose to you as a group rhetorically is really the heart of the matter. Ultimately, we have to ask ourselves, at least in my mind, what does it mean to be healthy in a holistic way? What does it mean to be whole? And what does it mean to be resilient? And I often share that, for example, I'm a rehab physician by training, but not infrequently I'll use antidepressants or I'll use anti-anxiety drugs. And I think these medicines, for example, have an important role for some people. But I would argue that there is no medication that is going to answer these basic fundamental questions about what it means to be human. So yes, drugs can play a role, but it's not going to answer these issues that might be arguably really the heart of the matter. So what I'm going to be talking to you about are some basic themes that we capture in a much longer program that we call our GRACE program. I'm just going to highlight a few snippets that I think capture some of the key ingredients for resiliency, at least in our perspective. And the first will be thinking about the idea of having a sense of meaning or having a sense of purpose, and thinking about what this may have to do with the idea of resiliency. And I'm going to start with really an anecdote, but I think it's a useful way to begin the conversation. This is the story of Mr. Israel Crystal. I imagine some of you may have heard of this gentleman. He got a fair amount of fame in 2016 because at the time he became the oldest male alive in the world. The oldest male. He was 112, which is of course a remarkable feat for anyone. But what really distinguished him and got him a fair amount of attention was not only did he make it to 112, but he also was a Holocaust survivor. And so you could imagine how much suffering he experienced. He lost virtually everyone that was important to him in his life had perished. I think I read that he whittled down to something like 85, 80, 90 pounds. He lost all of his belongings. Basically, everything was taken away. He endured, again, hunger and horrible working conditions and on and on and on. But he still made it. He actually passed away 1 year later at 113. And so when he got this Guinness record in 2016, of course, everyone is asking him, right, that one question, right? How in the world did you make it to 112 despite everything that you went through? And I'm just pulling out one passage from one interview. And again, I'm probably biased, but this is what stood out, at least to me. And here's what he said. I don't know the secret for long life. I believe that everything is determined from above, and we shall never know the reasons why. There have been smarter, stronger, and better looking men than me who are no longer alive. All that is left for us to do is to keep on working as hard as we can and rebuild what is lost. And again, I have no idea how he made it to 112 and later 113. I imagine luck and other factors played a role, of course. But if I had to guess, that last sentence in this passage probably played a role, right? This idea that he had a mission that I think comes across in this passage, right? He wanted to rebuild what was lost, to work as hard as he could and recreate something that was taken away from him. And of course, this is just an anecdote. This is just a story of one person. But there are others who have also made similar arguments. And probably the most famous of these is someone that I imagine some of you are familiar with. And this is Dr. Victor Frankl, who also was a Holocaust survivor. He was a psychiatrist, a young psychiatrist when he absorbed into the concentration camps. And between 1942 and 45, he was in 4 different concentration camps, including Auschwitz. And again, similar to Mr. Crystal, he lost everyone that was close to him. His mother, father, brother, pregnant wife, they were all imprisoned and they all perished. And again, he also suffered quite significantly. I'm not here to recount all the horrors of the concentration camp. But Frankl, as an observant psychiatrist, he kind of noticed something in the concentration camps. And one of his observations included this idea that, you know, let's say 1 in 10 people survived. And he was the first to admit that luck and other factors played a role, but his argument and observation was that it was more than just luck that played a role in the survival of, let's say, these 1 in 10 individuals in the camps. His argument was that if somebody didn't have a meaning in their suffering, they seemed like they were more likely to succumb to infections, to starvation, etc. That loss of hope was more important in someone's ultimate ability to succumb to illness, for example, than loss of food, for example. And so he really proposed this idea that if one can find a sense of meaning in what they're going through, that you can almost rise above any challenge that's in front of us. And he basically argued that there are 3 sources of meaning and purpose that one can find. And any one of these, he argued, could work. One could be in work, in some kind of service, doing something significant, whether it's volunteering or not. He argued that in acts of love and caring for another human being may give one a sense of meaning and purpose. And the third idea was to display and cultivate a sense of courage, particularly during difficult times, that any one of these arenas can give one a sense of meaning and purpose. And so he had this really eloquent way of articulating this idea that we are responsible, even if we're in the middle of a concentration camp, that we are responsible in how we respond to the situations that we're in. And so one of his famous quotes was the following: when we are no longer able to change a situation, just like he couldn't change necessarily his situation in a concentration camp, he said, we are challenged to change ourselves. Again, consistently, he argued that we have to come back to this idea that nobody can take away our ability in how we respond to a situation. Again, all this, believe me, is much easier said than done. And I think he raises an incredibly high standard, but I think he provides us the credibility. He gives the credibility for this idea that humans are capable of these real great spiritual heights if we are kind of rise up to that challenge. So again, Frankl wrote this book, Man's Search for Meaning, in the 1940s or 50s. It was a long time ago. And I could only imagine how he might, feel if he saw some of the more recent research studies that have been available to us today. And this was from a couple of years ago, where they basically looked at about 130,000 individuals, so a lot of people. It's a combination of 10 smaller studies. And what they were basically able to do is they were basically able to account for all the factors that we know are associated with how long somebody lives. So they knew who had diabetes and who had high blood pressure and who was obese and who was a smoker versus a non-smoker, and et cetera, et cetera. All the things that are known to account for our longevity. And then they did something interesting, right? They basically took that all into account in a statistical model. And then they compared those individuals that had the strongest sense of meaning and purpose compared to those that had the least sense of meaning and purpose. And as expected, what they found was basically the chance of dying from any cause was brought down by 17%. And the chance of having a cardiovascular event, right? So a heart attack or a stroke, for example, also came down by about 17%. So pretty significant, meaningful numbers in a way that I think is consistent with what Frankl might have predicted. And then there's other ways of looking at this. And this is something that I've been very interested in because I think it's a telling insight. So there was this interesting study that looked at individuals who were hedonic versus eudaimonic. And I think it's worth defining these terms for a moment. And basically, I think we all know what a hedonistic type personality is. It's right. It's basically someone who is a pleasure seeker, right? So somebody who enjoys the physical pleasures in the world. So hypothetically, for example, if I was at a cocktail party or dinner party, let's say, and if I knew the person, for example, sitting to my left was a very hedonistic type of person, I might assume, I don't know, that, maybe they're there because they knew there would be nice wine and that they were going to serve filet mignon, there would be nice music and people would be dressed up kind of nice. And they were drawn to these aspects of this dinner party, for example. Now, on the other hand, if I knew the person on my other side, on my right side, was a strongly eudaimonic type person, I imagine that's a term most of us aren't familiar with. And it's basically the opposite, right? So somebody who's very strongly eudaimonic, so that on my other side, for example, I might assume that they're at this dinner party because, for example, it was a fundraiser for something that they're really passionate about, or they wanted to have a meaningful conversation with a long lost friend that they haven't seen for a long time, or something along those lines. So it basically refers to this idea of being virtuous, of being of service, of doing things that are of meaning. And so those are the basic groups. And here's what they did. They basically, and I know this is an overwhelming slide. It's kind of a busy slide. I promise I'm going to walk you through this. So please bear with me. They basically looked at the hedonistic group and the eudaimonic group, and all of them reported high levels of well-being. So basically, with these questionnaires that people fill out, they all reported to be happy on the surface. But they decided to kind of look at their inner biology. So even on the surface, they're reporting high levels of well-being. They wanted to analyze their blood. And this is where I think things got a little bit interesting. So if you follow part A of this figure, what you'll notice is the hedonistic group had a higher level of this gene, this CTRA gene, that's associated with the fight or flight response. It's associated with adversity. It's associated with that kind of stress response. Whereas the eudaimonic group had downregulated that gene. You may be aware, and this is a whole talk in and of itself, this idea of epigenetics, right? Which is this idea that even though we inherit our genes from mom and dad, which genes are turned on or turned off may be to some degree controlled by how we live our lives and our lifestyles and other factors in our environment. And so this was showing that, again, a hedonistic versus eudaimonic outlook on life can really change how we're expressing this gene. And if you follow me along to part B, they also showed that the hedonistic group had higher levels of, excuse me, I'm gonna go back, higher levels of inflammatory cytokines. And I think many of us have heard of this idea that inflammation probably isn't an ideal thing to be experiencing in the long term. And they had lower levels of antibodies. And whereas the other side, the eudaimonic group, had the opposite. They had lower levels of inflammatory compounds, and you could see much higher levels of antibodies. So again, we could only imagine what Frankl would think if he were alive to see this kind of research. Because remember, his argument was that the people that seemed to have a sense of meaning and purpose, somehow they didn't succumb to the infections maybe quite as easily. And again, I can't emphasize this idea that didn't mean that the people who died in the concentration camps, that it didn't mean that they didn't want to live, or that they you know, didn't try hard enough in some way. And of course, luck and many other factors played a role, but Frankl was more interested in not why people died, but why anyone even survived. And his argument was that, again, that sense of meaning and purpose just gave people just maybe a little bit of an edge. And Frankl goes on later in his book and makes and beckons really his readers to stop asking the question of what do I expect from life? And instead, he implored his readers to ask the question, what does life expect from me? And I'm going to pause because I realize it's just a small change in the order of the words. What do I expect from life rather than what does life expect from me? But as you could imagine, the implications in how one lives life, whether we're living in this model versus the other one, couldn't be more profound. And again, from my perspective, really what it's saying is, you know, it's really analogous to the hedonistic versus eudaimonic model, right? So what do I expect from life is a little bit more analogous with the hedonistic model. And what does life expect from me is more about, right, the service, the meaning, the purpose, the virtue. And again, his argument was that if we ask the question, what does life expect from me, we'll be better able to manage and handle the adversity that we encounter. Again, I should mention, he uses the word life. I could imagine others might choose to interpret that as God or a creator or the world or nature, however it makes sense in your own personal situation. But it just brings us back to this idea of serving something beyond just ourselves. And that's what I think Frankl's power really really allows us to kind of wrestle with this idea that it's possible to change how we react and respond to these situations just by changing the types of questions that we ask ourselves. And I personally imagine that if we go about life asking what do I expect from life, that it probably works out okay when things are going reasonably normally in life, and it probably wouldn't cause any problems. But again, it's when we get maybe a pandemic or a medical diagnosis or severe trauma where going about that kind of outlook may make it much more difficult. Now, I imagine that there are some more scientifically oriented critics in the room who are going to argue, if I go back to this slide, that there are major biases with this study. So maybe the hedonistic group had more inflammation, fewer antibodies, had nothing to do with this outlook, but maybe they just ate, you know, more cake and had a different lifestyle. They were smoking more. Maybe that's why they had this different pattern. It had nothing to do with this outlook. And because this is just a cross section of a group of individuals. There was no way to analyzing which came first, the chicken or the egg in this. And that's true. That's a perfectly valid argument. But then, you know, I came across this more even recent study after that, which really, I think, changes that perspective. So I'm going to walk you through this. Hopefully this will make sense. So this was a study where they took about 160 women from the Southern California area, and they basically randomized them to 4 groups, right? So I'll walk you through this very briefly. They either told these women for a period of about 5 weeks or so, not that long, to be kind to the world, or to be kind to yourself, or to be kind to others, or a control group, which was asked, you know, basically not to change anything. I'm gonna walk you through this very briefly. So again, they had some baseline measures where they measured, remember that CTRA gene, that gene that is, you know, upregulated, regulated, or downregulated based on the amount of adversity and distress we're experiencing. And they had them go through that 5-week period, you know, living within one of those models that I just mentioned. And then they went through those measures again. So pretty straightforward. And so what did that look like? So the group that was asked to be kind to others, and I'm not going to read all this, but just to highlight a couple ideas, they were basically told to perform acts of kindness or generosity or thoughtfulness for others. So for example, somebody said in the study, they made some berry cobbler for a neighbor. Somebody else said, I washed dishes for mom, that kind of thing. And they did this for a period of 5 weeks. And then there was a group that was told to be kind to the world, right? And so these were things where they were told to perform acts of kindness, large or small, to make the world a better place. And so one person, for example, donated money to Plant Discovery Day, and somebody else gave things to Goodwill, and somebody else helped to clean up after a philosophy department event, that kind of engagement. The third group was doing acts of self-care, kindness to oneself, nice things for ourselves. And so one person wrote they splurged on a Thai coffee in the middle of the day. One person went to the beach, another person left work early, and they basically performed these kinds of acts for the duration of the study during the 5 weeks. And the control group, basically, they were told not to change, not to alter their routine in any way, just to kind of keep their typical kind of routines. Okay, so as I describe these 4 situations, I'd love for you to even just take a guess, whether it's in your own mind or if you want to venture off and put in the chat, whatever you prefer. I'd love for you to take a guess on which group or groups had a change in their CTRA gene, that gene that's associated with a sense of adversity and distress. And I can tell you, when I was trying to guess what happened, I guessed wrong. And I could tell you as I get to the next slide, there were no changes in the control group. There were no changes in the group that did acts of kindness for the world. So for like, and there were no changes in those people that did acts of self-care. The only group that experienced a significant change in that gene expression of distress was the group that was performing acts of kindness for others. And I realize that you know, in our society today, you know, where there's a lot of attention and focus on self-care, and I'm not here to downplay the importance of that. I think there's an important role for self-care, but at least from this study, there's no evidence that self-care made a change in our inner biology. It's actually the care and the acts of kindness that we perform for others that seem to make a difference. Again, right, I think analogous with the sentiments of Frankl, right? So, doing things that evolve a sense of meaning and purpose, and as it relates to others particularly. So that's theme number one. And for the next couple of themes that I'm going to go through more briefly, I want to talk about the value of learning the art of mastering perspective. And again, I will say again that none of these ideas I think are easy. And this has been taught to us by many wise individuals. Sean Aker was a psychologist at Harvard. He said that only 10% of your long-term happiness is based on the external world, while 90% is based on how your brain processes the world. This idea that he could know everything about your outside world, but not be able to predict how happy you are, but it's more how you perceive the situation around you that seems to make a difference. And the Buddha, for example, said the following: your worst enemy cannot harm you as much as your own thoughts unguarded. But once mastered, no one can help you as much, not even your father or your mother. And I should emphasize, it doesn't mean that we put on rose-colored glasses and just say everything that's happening in the world around us is just dandy and beautiful and it's all for the best, and kind of be a fake Pollyanna about things. I don't think that's not the intention of this idea. But again, it's just learning how to manage our thoughts and how we respond to situations that seem to be more important. And again, one can do this without being a Pollyanna about things. Not easy, I'll be the first to admit that, but it is possible, as we're going to talk about. And again, one of the people that had a really articulate way of talking about this was, again, Victor Frankl, right? In terms of controlling our thoughts. And I love this passage from Man's Search for Meaning. This is what he said. We who lived in concentration camps can remember the men who walked through the huts, comforting others, giving away their last piece of bread. They may have been few in number, but they offer sufficient proof that everything can be taken from a man but one thing, the last of the human freedoms, to choose one's attitude in any given set of circumstances, to choose one's own way. And there's a number of ideas and quotes that have been attributed to Frankl's ideology. This is another one that I think really is the heart of what's known as cognitive behavioral therapy, this idea that how we respond to our situations by managing our thoughts can really change how we feel. And this is one of those quotes. It says, between stimulus and response, there is a space. In that space is our power to choose our response. And in our response lies our growth and our freedom. Again, giving us the challenge and the responsibility to try to manage, again, our own thoughts and our own ability and how we respond to the situations that we're dealt with, which again is still not easy. The other idea that, at least for me, I think has been useful is beginning to grapple with the idea of legacy. And this is a hard one because when in our society, right, when most of us think of this word, right, if the first thing that we think about is the will or the estate plan, or what goes on the tombstone, or who inherits the dishes and the car and the house, and these kind of really morbid ideas. But I'd like to argue that it's worth reframing what legacy could mean in a way that really allows us to live a more powerful life. And the analogy I often think about, for example, is putting aside current day politics, but if you think about a US president, for example, right? They're there for 4 years or 8 years, let's say. And if I asked you, when do they begin to think about their legacy? Is it day one or at year 3.5 or 7.5, let's say, when they're on their way out of the Oval Office? I think most of us will agree that a US president, generally speaking, or almost invariably, right, will be thinking about how their legacy is going to be defined on day one, right? When they walk into the Oval Office, they're going to be thinking about how they want their legacy to be remembered. And because they know they only have a certain amount of time, whether it's 4 years or 8 years, there's only a certain period of time you have to be in that office. And so you want to make those days count. And I think the argument goes that the same idea extends to all of us, right? We all, and I know this is something that we don't like to think about generally in our culture. We all are going to be here for a certain amount of time. And if we don't have any sense of our legacy, which reminds us of, albeit I realize it reminds us of our mortality to some degree, I think the irony is that, or the paradox, I should say, is that unless we sometimes grapple with the idea of our mortality, it becomes really hard to live as well and as fully now. And so I love this quote: "A society grows great when old men plant trees whose shade they know they will never sit in it." It's again reminding us of this power when we engage in acts that go beyond our immediate needs and our kind of immediate gratification. And so there's this idea that whereas in our society we tend to think about often how we should invest our money, we don't often as much, I would suggest, think about how to invest our time. And again, with our iPhones and social media and Facebook accounts and replying to emails and text messages and whatnot, we're often spending a lot of time and our attention on things that are urgent but not necessarily important, when we know that, right, we should try to come up with a system that allows us at least once in a while, right, in a structured way, to think about things that are important, even if they may not be urgent. And of course, this is a lesson that's been taught to us from, I imagine, every, religious context and spiritual context in the world. One of the quotes I love from a psalm is, it says, "Teach us to number our days that we may get a heart of wisdom." And I love this passage because, again, it's echoing at the same idea that if we learn to number our days, right, it reminds us that we're all only here for a certain amount of time, and that will then hopefully give us the wisdom to again live as fully, and will give us the insight to spend again time on the things that are important, even if at the moment they may not be as urgent as replying to that text or replying to that social media thread or whatever we may be doing. The other idea that's worth remembering is that we're all creating our legacy. It's just we may be aware of it or not. And so the benefit in this kind of exercise for those that engage in it is that it brings this process that we're all doing, whether we have awareness of it or not, into our consciousness. And this is where I think Maya Angelou's quote is really resonating with. So she said, "You have no idea what your legacy will be. Your legacy is what you do every day. Your legacy is every life you've touched, every person whose life was either moved or not. It's every person you've harmed or helped. That's your legacy." Again, reminding us that we're going to be creating a legacy, and it's probably in our own self-interest to have some awareness of how we want it to be defined. the next idea that I think is critical to resiliency is learning to cultivate some kind of practice of gratitude. And the science has become more and more clear in my mind over the last decade that people who experience gratitude more regularly, they tend to be present-centered. They tend to have less of some of these negative emotions such as anger, resentment, envy, etc. It seems that people who are grateful more often sleep better, they have stronger immune systems, they're more likely to empathize with others, they have better social ties. And the reason I'm mentioning here is they seem to be more resilient to stress and distress. Now, I used to believe that, you know, I'll experience gratitude when everything in my life is like lined up perfectly, right? When you got like straight A's, then I'll be grateful. When you got into the school you want to get into, then I'll be grateful. When you got, right, when a salesperson meets their sales target, then they'll be grateful. And the challenge with that is, right, we only experience these kind of hallmark moments every once in a while. And the people who really study gratitude have really taught this idea that we can experience gratitude without thinking that life has to be perfect, right? Because if we wait for these moments, it's going to happen probably every blue moon. It's not going to happen very often. And so we've really, for some of our programs, employed and integrated the work of Brother David Steindl-Rast. He's still actually alive in his early 90s. He was a Benedictine monk, and he's really spent an enormous amount of time teaching others how one can experience gratitude, even when circumstances may not be perfect. And he has a way of teaching this in a way that's really authentic. So he says, does that mean we can be grateful for everything? And he goes on to say, certainly not. We cannot be grateful for violence, for war, for oppression, for exploitation. On the personal level, we cannot be grateful for loss of a friend, for unfaithfulness, for bereavement. But I didn't say we can be grateful for everything. I said we can be grateful in every given moment. And his argument was that most of the time we can be grateful for, right, whatever, you know, the moment offers us, whether it's the beauty that we may be surrounded by, or an experience we may be having, or, you know, utilizing any of our senses. And that when circumstances are difficult, his argument was that we can be grateful for the opportunity perhaps to learn from that situation, or to help others, or to teach others, or to do something in a way that allows for our growth. He has an amazing TED Talk that I would highly recommend, you know, everyone to watch if you haven't seen it already. He really tells a really compelling story and provides, I think, a sauce on a three-step process on how we can experience gratitude without being a Pollyanna about things. And this is another one of his quotes that I love, and because his argument often is that the thing that we can be most grateful for is just having this day, this moment. And this is what he said. You think this is just another day in your life. It's not just another day. It's the one day that is given to you today. It's given to you. It's a gift. And the next, and I think as I round things up, one of the final themes I really want to spend a couple minutes talking about is the value of connectivity. And I often, in many of my talks, ask this question. I ask, you know, what human condition increases the risk of death as much as smoking cigarettes and more than inactivity or obesity? And most people, when they hear this, they often guess, you know, maybe it's stress or depression or anxiety or something along those lines. And I'm not saying that those things don't have perhaps some of its own risks, but the literature has become pretty clear that chronic loneliness can truly change how our cardiovascular, immune, and nervous systems work. It's associated with a higher mortality rate in the general population. There's more and more evidence that for some cancer types, like breast cancer, it's associated with a higher rate of mortality. And again, this is an evolving science. But there's this concern that this is not just an issue for those of us that, for example, went through maybe a cancer experience, but something we're experiencing as a society. And so, for example, there are about 35 million Americans that live alone today, which is over a quarter of our households, and the number of single person households has really increased considerably from 1960 to today for a variety of factors. And this was an incredible study that I just want to describe to you momentarily. They basically asked Americans with a survey originally in 1995. They basically said, how many people can you really count on or rely on during a time of need? And basically, in 1985, about 1 in 10 Americans said, nobody. There's nobody I can really discuss an important personal issue with. And then they kind of repeated that survey about 20 years later in 2004. And then at this time point, almost 1 in 4 Americans, so right, almost 25% of us said there's virtually no one that they can discuss an important personal issue with or confide in during a time of need. So I think it's worth taking this in the context of how society is structured today. And I think it's worth emphasizing that when we talk about loneliness, particularly chronic loneliness, right, because we all experience loneliness sometimes, it's really important to remember that this is a subjective experience, right? We all know people who, for example, are married and maybe feel very lonely, or people that have all kinds of people around them and still feel very lonely. And we all know people who live alone and don't feel lonely at all, or maybe they just have one close cousin or an aunt or one person that they feel connected to, and that's all they need to keep from experiencing loneliness. And I have a Facebook image there because I think it's complicated, because similarly for some people, social media has been life-saving in that it allows them to stay connected to people. I mean, I wouldn't be connecting with you here today if it wasn't for technology, especially during a pandemic. And for others, we could have 800 Facebook friends and still feel incredibly lonely. So it's important to remember that this is a subjective experience. And one of the things that we spend a lot of time thinking about during some of our programs is reminding us that if we are experiencing loneliness chronically, we can overcome this. And for some of us, just knowing that there are health benefits and just remembering that and leveraging that idea to work to stay connected. And I realize it is work to deal with the challenges of our relationships, but that it's probably worth those challenges. And for others, working with a therapist to change how we're seeing some of our relationships and maybe interpreting them a little bit differently may be helpful. But I love this quote from one of the scientists that's really done a lot of the loneliness research. And this is what he said. He said, the degree of social connection that can improve our health and happiness is both as simple and as difficult as being open and available to others. So in other words, I think what he's saying is there's this medicine, right, that can, improve your survival, probably reduce your chance of developing dementia, probably reduce your risk of heart disease, maybe reduce your chance of recurrence for certain types of cancer, and on and on and on. It can do all these things, but it's not a pill. It's the effort that comes with staying connected, with the people that mean most to us. So I realize I bombarded you with a bunch of ideas, and I want to emphasize that when we explore these ideas in our program, we kind of dissect this over a period of 12 hours, and I tried to just throw it at you in about 45 minutes. But if I had to summarize some of the pearls for enhancing resiliency, it would be thinking about meaning-centered living for the reasons that we described. It's learning the art of, again, without being a Pollyanna about things, but having some balanced perspective on how we're seeing the world in a way that is more empowering, and learning to try to integrate a sense of gratitude, which is feasible, even though difficult when we're going through challenging circumstances. Integrating a sense of legacy, which I believe, again, gives us a sense of perspective on the things that are really important, and maybe allow us to spend a little less attention on the things that don't matter as much in the long run. Staying connected for all the reasons that we just discussed. And even though I didn't talk about it much today, learning to be mindful or meditating and trying to keep a sense of humor in a way that makes sense to us. We kind of explore these topics in much more detail in the full program. So again, all of this is much harder to do when we're facing difficult circumstances. But I've been humbled by so many of our amazing patients. Right, I learn from them, and I see that while it takes an usually incredible spirit, that people teach us that these things are feasible. And it's not a drug that allows us to achieve these ideas. It's the types of thoughts that we think about and the kind of disciplined behaviors that we engage in that really seem to make a difference. So again, I thank everyone for your attention. I thank my colleagues for inviting me, and if there are any general questions or comments, I'll be happy to take them as best as I can. And again, thank you again, Dr. Erickson, for the invitation.
No, thank you. I think you've given us some really deep things to think about. And I think, viewing this in the context of a pandemic, only adds, I think, to the value of some of these things that you're talking about. At least for me, it's really made me think about some of those things. Yeah, if people have questions, feel free to put them in the chat. I had a question. You had shown that study in the beginning that was looking at the CTAR gene expression changes in the different sort of personality types, or I'm not sure the best way to describe it. Did they find that also correlated with, did they look at other variables or subjective variables of happiness, or, what was sort of the outward expression of those changes? Did they mention anything?
So the original study that I mentioned, they actually looked at like well-being and happiness, and all of them had high level, whether you're hedonistic or eudaimonic, they had high levels of well-being. But again, the inner biologies with inflammation and antibodies and the CTRA gene were quite distinct between the two groups. The second study, which said, okay, we're going to take a group of women, however you've been living your life up to this point, it didn't really matter. We're going to ask you for these 5 or 6 weeks to live in one of these 3 or 4 different outlooks. And I think the primary objective of that study was primarily how that gene expression changes. I don't remember quality of life measures necessarily. I could look at that in more detail, but I think what that second study, the reason why in my mind it was so powerful is that it reminded us that we can change our physiology in just 5 or 6 weeks of a kind of of a disciplined behavior of doing acts of kindness, basically.
Yeah, no, I was blown away by the time frame, right? Of
It's
these
incredible,
things.
right?
It's
Yeah.
fascinating. Yeah.
And we have to wonder if we kind of employ that for 6 months or a year or 2 years, then what kind of cumulative effects may occur over that time. So that's why I thought that one was particularly interesting.
Yeah, no, absolutely. Other questions? Someone says, I wonder about the benefit of having opportunities for patients to volunteer in a cancer center. Many individuals that completed treatment are very motivated to help other patients that were newly diagnosed.
I love that idea because, and I can tell you anecdotally, I've seen that where when people, when some of our patients have completed treatment, and actually at our institution, we require everyone to be done for at least a year just to give some space from, the experience. But as long as I in my mind, if it's something that is meaningful to that individual, I think this acts of service, particularly for something that they've experienced and are able to provide some kind of mentorship to others in a way that probably nobody else could, I think could make a big difference.
It's interesting. So I see patients at our children's hospital that had childhood cancer, and I see them when they're young adults. And I have been blown away by how many have chosen a profession involved in helping in service to others. Many, have gone into nursing, into medicine, teaching. It just seems like a much higher percentage that really it's sort of changed their outlook on things, and their perspective is quite different among sort of my patients that haven't had that young childhood cancer experience. And I have to wonder how much of this is factoring into that, right?
I could imagine it would, absolutely. So again, I appreciate the opportunity. I'll leave my I'll be happy to leave my email in the chat if anybody has any questions or concerns that might occur to them later. I'll be happy to do my best to respond then as well.
And real quick, what was the name of that Benedictine monk that you said, the TED Talk? I would love to check that out.
It's an amazing TED Talk. It's only about 11 minutes or 12 minutes or so. It's David, and his last name is Steidl, STEIDL-RAST.
Okay, great.
It's worth 15 minutes of your time.
Great.
Promise.
All right. Well, I want to thank you, Dr. Asher, for speaking with us tonight. I think it's you've given us some really valuable lessons and things to think about and ponder for certain. And I want to thank all of you all for attending and giving up an hour of your precious time. So I hope everyone has a really good evening.
Thanks so much, and happy holidays to everyone.